Hi, I'm Sarah Lubert, Executive Director for the Missouri College of Emergency Physicians. And today with me, I have Sarah Hankey, who works with our lobbying team. Just a reminder, in case you haven't registered yet, our Advocacy Day is coming up on February 28th. It's in Jefferson City, and we start the day at 9 o'clock, and we will go over to the Capitol and have legislative visits. And we will give you a preview now, and then also be that day before the event of what is coming up and what to talk about. So, Sarah, do you want to give us an update on what's currently going on?
Yeah, sure. So we are, I believe, 7 weeks into the legislative session. There's a total of 19 weeks, so we're not quite halfway through yet, but we do have a solid month of legislative session under our belt, which means committees are really up and going. There has been significant floor debate on both sides of the building. The House has focused a lot on IP reform. The Senate has focused a lot on education issues, and then both chambers have focused a lot on public safety, but there's a lot of things that are coming down the pipe to be addressed on the floor. One of those is an issue that you guys are going to be advocating for on Advocacy Day, and that is the extension of benefits for women who are postpartum. Currently in Missouri, if you are on Medicaid or if you are pregnant, you are eligible for Medicaid and for CHIP. And those benefits start the moment that the woman realizes that she's pregnant through 60 days after pregnancy. And as many people know, there's not this magical day on the 60th day after pregnancy where your body snaps back into its regular self. There's often what the Pregnancy Associated Mortality Review Board found is that a lot of the morbidities and the deaths that happen as pregnancy related medical events happen are post birth or post pregnancy. The most medically significant event that happens during pregnancy is usually birth. And so I think a lot of, especially the feds, have realized that that 60 days, whenever it was first implemented, is pretty arbitrary. So the push is to get that extension from 60 days to a full year. The CDC defines the postpartum period as a full year. To do this, it's going to cost a little bit of money from the state. To implement this coverage extension, it's estimated to be about $8 million. But an economist did a study, and because of the access to continuation of care for complications or comorbidities that come along with pregnancy, the ER diversion, the maintenance of care is actually going to reduce that fiscal impact to the state to somewhere closer to $2 million, which is great news. But fortunately, this year, there's been a lot of bipartisan push behind this legislation. A lot of people realize that it's very important. In the opening statements from the President Pro Tem, Caleb Rowden, he said that this was a priority of his. So that's great. This is not the only healthcare conversation that's happening this year. Senator Onder last year, he is termed out now. He was replaced by Senator Nick Schroer. Onder was very pro-physician, very protective of scope of practice issues, no matter the other issues that he may have brought along the way. But Nick Schroer, his wife, is a nurse practitioner, maybe an APRN. And so he has always been the proponent for the nurses in the House, has always carried a piece of legislation that either weakens or completely dismantles the collaborative practice agreements between nurses and physicians. His bill has been heard he has Senate Bill 79. His bill has been heard in the Senate Committee for Government Accountability. We have a very strong pro-physician involvement in care membership on that committee, as well as the chair. She is very complimentary of physicians. Their training understands that there is a difference and there is importance in the care team model, and dismantling that is not going to be good for quality of care for Missourians. So the messaging has been really great in that, nurses, APRNs play a very valuable, very significant role in our healthcare system. However, physician-led team care is the way to go. And it has been proven time and time again to provide the highest quality care. Access in rural regions, we realize, is an issue, but dividing the care team model has never truly proven in other states to address the shortage of access of care in those rural regions. So the lobbying team is meeting together to update the collaborative practice arrangements to how healthcare is being delivered or should be delivered nowadays, updating issues related to technology, allowing there to be delegation of some of the collaborative practice agreement components, such as like chart reviews, things of that sort. And we have made it very clear to the sponsor that we are never going to support legislation that at some point or another takes the physician out of the picture for the patient care. It is a hot topic, has been filed several times in the Senate, many times in the House as well. And that's because there's no physician in the Senate for the first time. However, we do have Dr. and Representative John Patterson, who is the majority floor leader. He dictates what bills come up when on the House floor. And so we do have actually in leadership for, I think, the first time ever, a physician in the House. He will be a strong proponent for physician-led care. So we feel very confident about where these bills are, in that it will require an agreement between both parties for either pieces of legislation in the House or the Senate to move forward. The rhetoric around the issue is tough. It is commonly that nurses provide the same quality of care and at cheaper, and they are willing to move to any rural region to open up an independent practice and care for everyone. So to combat that, we again talk about the team care model. We also talk about how in other states this isn't working. And it is important, there's a little bit of a wordplay game, that the nurses have been saying that in every other state, there is no mileage restrictions, there's no collaborative practice agreements. It's just because these things are called something different in other states, or other states even spell out the scope of practice for nurses. There's no spelling out of scope of practice for nurses in our state statute, especially in a collaboration. The physician is able to delegate whatever they believe is within the training and scope of their training to the APRN. So once we kind of point that out to legislators, they draw back a little bit and they're like, okay, Missouri's not just living in this antiquated world, in this very rare team care delivery model. This is actually something that is either happening in other states, they just call it something differently, or it's something that we like because it gives a good safeguard for our patients, for our constituents. So I know that was a lot on the scope issues. There's been a ton of rhetoric around it, a ton of discussions, but we believe these bills are in a good place. I think focusing on reiterating the training, the certifications, the continued education, and just the basic building blocks of educational phases you guys go through to legislators who maybe don't even know a doctor personally would be very helpful. Explaining like undergrad is different than medical school, which is different than residency, which is different than fellowship, is something that a lot of legislators actually don't understand. So conveying that is extremely important during Advocacy Day, relaying that the role of the nurse in the care team model is extremely important right now, and that cannot be replaced, but it's not going to be good to drive a wedge between the care team model that does deliver good healthcare results. So I know that Sarah knows how to get a hold of me. We send out weekly reports and are happy to talk to anyone about these advocacy issues as they come up, but we'll be touching base again with all of you who are coming to Advocacy Day.
Sarah, that's great. Thank you so much. It sounds like this is a really important issue for us to hit on hard this year, and it's really important for us to get as many people to Advocacy Day as possible. Are you guys seeing a large number of APRNs and nurse practitioners coming to the Capitol?
We are. They're coming, and this is not an exaggeration, in busloads. They are seemingly everywhere. They wear their scrubs, they wear their caps, kind of putting on the spectacle, which I don't believe is necessary at all. So there is a large showing from the nurse profession and the nurses associations, not just APRNs, but also CRNAs, because there's a separate bill about anesthesia administration going through too, relating to scope of practice. So we've got all mid-level providers kind of represented in the Capitol quite frequently. We reiterate, like, we can't close our practices down and show up to the Capitol every day. Our physicians can't. And so having you guys set aside time for advocacy days, very important. And we thank you for it.
That sounds great, Sarah. Thank you so much for your time. We appreciate it. And we will see you on Advocacy Day. And again, if you haven't registered yet, registration is open for just a few more days. We would like to get registrations in by no later than February 23rd-ish, because Advocacy Day is February 28th. And we do go ahead and make those legislative visits appointments for you, and you're in groups. So it's a very fun, easy way to learn how to advocate. So thank you so much for your time, Sarah, and we will see you on February 28th.
Yep. Thank you.